Okay, so hello, good afternoon, and tell me if this is okay. Previously, last time when we were here together, the sound wasn't very good. So please tell me if you can hear me well. Sibe Somwangara, is my sound okay? Faith Yumba. Good to see you. So tell me, is my sound good? Sound is good, Doc. Excellent. That's very good. That's very encouraging. Right. And good to see you all. We haven't had this is can you imagine the whole of this week? This is our first conversation as a live conversation. So we are going to discuss this issue of heart failure because a lot of you have been asking questions in my inbox, and I noticed that quite a few people wanted to, have a clarity on heart failure. Some of you are nursing relatives at home who have heart failure, or you know someone who has heart failure, and so you've asked me to, talk about it. I noticed that quite a number of people that come through to the inbox, that's the issue. The other issue is that for those of you who come to my inbox, you will notice that for some, you've been waiting for a very long time without a response. Others may not even have gotten a response in the inbox. It's because the inbox is packed. It's busy, it's jam-packed. So what I do is that we respond to some of the questions as much as we can directly to you in the inbox. But when we see that the question is being repeated over and over again, we bring it up here for us to discuss it live, so that in case some of those questions that others had, some of you may have been presenting similar questions, then we can answer the question together at once. And also we took note of the listed topics that you gave us in the last question that we had asked you to suggest topics, and so we'll be going through some of those as well very soon. So next week will be quite busy. We may be going live every day next week to address a number of those issues that you raised. So today, let's look into this issue of heart failure. First of all, we will approach it this way. We will, define what heart failure is. We will talk about the symptoms, signs and symptoms. How do you know that someone is in heart failure? Then we'll talk about the causes. How does heart failure arise? What are the risk factors? We'll also talk about how you can avoid getting heart failure. We also touch on how it is treated. What are the principles of treatment of heart failure, and how do doctors approach heart failure in terms of treatment? So that's the approach we're going to have this afternoon, and we will take, not less than 20 minutes to finish this. So let's get started. So when do we say that the heart has failed? Now, for you to say someone is in heart failure, you first of all have to understand the function of the heart. What does the heart do? All right. What does the heart do? I remember we joked about this. We said the heart does not fall in love. The heart does one job, and that is to pump blood. And its job is to make sure that it is able to maintain your blood pressure and maintain your blood movement in such a way that oxygen is delivered to the tissues and other nutrients are delivered to the tissues. And then the waste is also carried away from the tissues to parts of the body that process it and throws it out. So when your heart is said to have failed, it is when your heart is failing to maintain that pressure. It is failing to maintain or sustain the flow of blood to sustain your life. Meaning that your heart is failing to maintain that pressure, that efficient flow of blood around your body. And therefore, you find that oxygen is being poorly delivered and wastes are poorly being, mopped out from there. So that's the basic definition of heart failure. So your boyfriend disappointing you or your girlfriend disappointing you and you feel nasty about it, that is not heart failure. That is actually happening in your head, because emotions, that's where they are processed, because that's now perception. So your girlfriend disappointing you or your boyfriend disappointing you, That's not heart failure. Heart failure is the issue of pumping of blood, where the pump itself is not pumping blood enough. So now that's a basic definition of heart failure. Of course, technically there are other features that the technical definition is a bit more complex than that, and I'm being very simplistic in my definition. Now, how do we know that you have heart failure? First of all, you will notice, even you yourself, you will know that you have heart failure if or when you start noticing that you are unable, or you start noticing that you get tired easily. You take a short walk and you're suddenly tired. Do you know why you feel tired? Let's go back to the definition of heart failure. We said heart failure is when the heart is failing to sustain the efficient flow of blood such that oxygen is delivered to the tissues efficiently and waste are taken away. Now, when you are walking or you are climbing a flight of stairs, you are increasing demand on the tissues for oxygen and also removal of waste. As a result, your heart responds by working even harder, either to pump faster, increase heart rate and things. Now, when your heart has failed and is being inefficient, your tissues, okay, your muscles will suddenly start getting tired quicker. Why? Because they're not receiving oxygen on time and the waste which is accumulating is not being removed efficiently. That is why you feel tired easily. Okay, when you have heart failure. The other thing is that when you have heart failure, you will find that you cough a lot. And the reason you're coughing a lot, it is because water is accumulating in your lungs. And when you lie, you're unable to lie flat as well. You find that if you lie flat, you cough and you get up. And at night, when you're about to sleep, you have what we call, you start, gasping for air. Sometimes you wake up in the middle of the night because you can't breathe properly. You even have to open windows. You even go and sit outside because you are failing to breathe properly. Okay? And for you to sleep comfortably, you have to sleep almost in a seated position at an angle. You need more pillows. The reason you need more pillows is because remember that when the heart is failing to pump blood forward efficiently, there's a backflow or a backlog of blood. Now, that backlog of blood creates back pressure. And that backward pressure, you'll find that water and fluids begin to seep out of your blood vessels into the tissues. That's why you find that people who have advanced heart failure, they have swelling of legs, which we call edema. When the legs swell, that same swelling also happens in the lungs, and that's how they fail to breathe. Okay? And that's how they fail to breathe. And because of that back pressure as well, other organs also begin to swell. For example, the abdomen will swell, the liver will also swell. That's why they end up with abdominal pain, because the liver is swollen. So that's how you know that you have heart failure. So now, what are the causes and risk factors? In majority of cases, you will find that if you find heart failure in a child or in a baby, it is because that child or baby was born with structural abnormalities on the heart itself. So the child was born with structural abnormalities, and the structural abnormalities can be of any range on the heart. It could be the valves that are abnormal. It could be the wall of some walls of the heart that are abnormal. It could be the tubes that carry blood out of the heart that are malpositioned. So the child may end up with heart failure. So when you see heart failure in a child, generally speaking, it is because there's an actual physical structural abnormality on the heart. Either the child was born with that structural abnormality or it was acquired. One of the causes of acquired structural abnormality on the heart in children is a sore throat. That is why, as parents, when you see your child has a sore throat, don't ignore it, because a simple sore throat can very easily lead to a damaged heart in your child. So if you see that your baby has a sore throat, it's very, very important that sore throat is treated very aggressively. So do not underestimate, especially for health workers who are listening to this, do not underestimate a sore throat in a child, because it can very easily lead to heart failure. Now, in adults, Adults can also have structural abnormalities on the heart, but then usually adults, it is because of other risk factors like high cholesterol, which end up blocking some pipes that supply your heart muscle. So that is why, as adults, if you are 40 years and above, it's very important that you check your cholesterol every year, once a year. So if you are listening to me right now and you're 40 years and above, when did you last check your cholesterol? Do you know your cholesterol right now? Most of you don't. That's why I find that even here at our clinic, we've offered it's a small package. Pass through, do your cholesterol, or go to your hospital near you, let them do your cholesterol. It's very important. So if you have high cholesterol and you don't know, you may end up in heart failure. Why? Because that cholesterol has a tendency to block those blood vessels, causing heart muscle not function properly. Smokers, people who smoke, they're at risk of eventually developing heart disease and ending up in heart failure. Diabetes, if you're diabetic and your blood sugar is not very well controlled, hypertension, high BP, high blood pressure. This thing where people start discouraging each other, no, if you start drinking mankwala or drinking or taking your drugs regularly for high blood pressure, there's this thing that will happen or that thing that will happen. Do not listen to people who talk like that. Okay? Do not believe anyone who is discouraging you from taking your medicine for high blood pressure, because you end up in heart failure. And when you end up in heart failure, depending on the degree of damage, your heart may be damaged permanently. So when people are discouraging you from taking your drugs for either for BP or for blood sugar, just pay attention to them and ask yourself, what is their real intention? Is it that they want to inherit your wife? Is it that they want to inherit your husband? What is their intention? Check people's intentions, especially those who discourage you from taking your medicines for BP. Because when blood pressure is not very well controlled, it also very easily leads to heart failure. Now, in Zambia, another thing that has been leading to heart failure, especially in young people, it's alcohol abuse. Alcohol abuse has led to serious problems with heart failure. So if you see a young person between the ages of 25 to maybe 35 thereabout, and they've come to the hospital and they look older than their age and they have heart failure, if you check, you'll find that they drink alcohol senselessly. They abuse alcohol. So alcohol abuse is a known and well-documented cause of heart failure that you need to pay attention to. Okay? So pay attention to that. Now, other causes of heart failure that may happen is where you have pregnancy-induced cardiomyopathy, where the heart muscle in some people who are vulnerable may be compromised because of pregnancy. And for such people, once they deliver, their heart also goes back to normal. But again, in some people who are vulnerable, you'll find that pregnancy itself can induce changes on the heart that can even lead to heart failure. So just bear in mind with such things. But then, how do you prevent it? The way you prevent heart failure is that there are certain things that you do, okay, that put you at risk that you need to control. For example, excessive alcohol. Be very careful with how much alcohol you drink. Alcohol can be beneficial, but if you abuse it, it can actually destroy you. Smoking. Now with smoking, especially people who like smoking shisha, yes, you look cool, you look modern, but what you don't know is that as you are doing that, when we are looking at you as healthcare workers, we just get surprised that, you are, because remember that shisha contains a lot more cigarettes than a single stick of cigarette. So that shisha you like smoking, okay, one day you will pay a big price. One day you will pay a very big price over that shisha that you like smoking. So be very careful. And don't sit around people who smoke shisha. If you don't like smoking, if you're in a nightclub or whatever, and there are people smoking shisha nearby, just excuse yourself, move away, go and sit somewhere else. Because passive smoking is also a problem. In fact, it is worse. So if you smoke, just quit smoking. There's no health benefit to smoking. There could be some benefit with beer, but smoking, what do you benefit? I have never seen anywhere where it's documented that smoking has any health value. There's zero health value in smoking. So just stop. Now, if you are hypertensive and you have high BP, the way you prevent heart failure, make sure your BP is well controlled. How do you control your BP? Make sure you take your drugs every day, religiously. It's also, for example, if you have diabetes, make sure you take your drugs every day. Okay, make sure you take your drugs every day, and you control all those things. Once you control these things that are controllable, you are going to avoid heart failure. But then there are some things that are not controllable. For example, you don't know that your baby may be born with a problem with the heart. That you can't control. You don't know. Okay? So there are those things you can control. But there are certain things you can control. For example, if your child has a sore throat, get the sore throat treated quickly. And that's how you prevent heart failure in children as well. All right? So pay attention to some of those things. So how do we treat heart failure? So heart failure, the way it is treated is that, remember I said that you get water which may be accumulating in the tissues and things like that. So your doctors will give you drugs that will remove the water. There's that drug they give you that takes you to the toilet so frequently. It's called a diuretic. And then they'll also give you a drug to strengthen your heart muscle in terms of pumping. Okay? And then they'll also give you another drug that we use, what we call remodeling, where the drug will help the heart muscles to try as much as possible to take them back as close as possible to where they were. So there's a selection of drugs, a combination of drugs that your doctor will choose. But then the choice of drugs that the doctor will choose also will depend on what caused your heart failure. Because some of the drugs they will give you would be to prevent any further damage to the heart. If the mechanism of damage was, for example, say you had a blockage of your tubes to the heart because of too much cholesterol. So they may put you on drugs that lower cholesterol. Okay? So say, for example, you had a heart attack because one of your blood vessels was blocked. So they may put you on drugs to unblock some of those arteries. So remember that any treatment may also be, some of the treatment principles of treatment would be to manage what caused the heart failure, in as much as they are putting you on drugs to prevent further deterioration of symptoms. So that's how you treat heart failure. Okay, and also your doctors, when they're asking for tests, the tests that they'll be asking for, they'll be intended, first of all, to identify the cause, and also the tests will be intended to assess the extent of the damage of the heart, and then also some of the tests will be intended to for monitoring treatment, and some of the tests are intended for planning treatment. So there's a range of tests that you might do, and the tests are intended for any of those purposes going forward. Okay. For example, this machine that you see in the background, the machine you're seeing behind me is an ultrasound machine, but it's also capable of doing what we call a cardiac echo. And a cardiac echo is able to show us the actual heart itself physically. You can see it physically. On this same machine you're seeing behind me, you can see the heart physically. And as you are looking at the heart, you are able to see how much blood is going into the heart, how much blood is going out, how efficient is the heart functioning, and all those. And they'll do all those things that the doctors like to do to be able to identify what problems you may have on your heart. So that's how heart failure is treated, and that's how it is investigated. And those are the symptoms, and those are the things you need to do to prevent heart failure yourself. Right. Yes, 19 minutes. I predicted that will take about 15 to 20 minutes and we are done. Enjoy your lunch. If you haven't had lunch, if you've already had lunch, well, enjoy your weekend. If you're going out, please be safe. And if you're going to drink, drink responsibly. But above all, go and get vaccinated. In my next live video, I'll be discussing vaccinations. I know that I posted something that caused a bit of anxiety, that I'm trying to get you, to force you to get vaccinated. I'll come back and give you my rationale for that. Okay? Enjoy the rest of the weekend. Do take care.